nothing to do with hurling actually, because I wasn't a very good hurler. Minister, delegates, guests, it is my great privilege to welcome you to this our 37th annual delegate conference held for the first time in County Meath, the Royal County. As always, a special thanks to the organising branches, the Meath Mental Health and Meath Intellectual Disability branch. For the second year running, two comparatively new branches have taken on the mammoth task of organising conference. They have done us proud. I also want to welcome the Minister for Health and Children, Ms Mary Harney, TD. Last year I welcomed you, Minister, as the best paid Minister in Europe. This year I want to welcome you as being a substantially better paid Minister. Having benefited from the substantial increase awarded to those in privileged positions in government and in the top echelons in the public service through the recommendations of the Higher Review Body, the world's best paid health minister presiding over a dire health service. I anticipate, Minister, that you will say in response that you are the world's best paid minister because, as the lady in the shampoo ad says, I am worth it. Which brings me to our worth. The clear message is that nurses are of little worth. I would say that the last year has been for nurses or annus horribilis for all the reasons associated with the benchmarking report, the failure of the government to honour commitments on the introduction of an appropriate compensation scheme, the pressure of trying to deliver a service following the imposition of savage cutbacks, and also because nurses now know for certain that they are not respected or valued. For years, governments have insisted that when the financial situation allowed, that nurses should be the first of all workers to benefit because of the arduous and difficult nature of the profession and because of their commitment, dedication and loyalty to the most essential public service of all, the care of the ill and the dying. When government had the money to pay us, what did they do? Government henchmen attempted to demonise nurses. The dispute in the early part of 2007 was organised and planned so as to ensure that patients would not suffer. Public rallies, public demonstrations and a work to rule that allowed nurses to concentrate on nursing rather than giving time to non-nursing clerical and admin functions. At the end of the dispute and to the end of the dispute, sharp work stoppages. The reality is that our dispute impacted positively on direct patient care and no patient was put at risk. During our dispute, every dirty trick in the book was used by management to attempt to trash the reputation of nurses and the nursing profession. We know that the first function of the HSE Management Nerve Centre monitoring the dispute each morning was to ring hospitals and services to establish if anything happened over the previous 24 hours that could be attributed to the dispute in any way. Well, the henchmen didn't find anything. Nurses, though, have learned a valuable lesson. In terms of this ongoing and unresolved dispute, one might as well be hung for a sheep as a lamb. I will come back to this issue presently. I wish first of all to deal with the compensation scheme for psychiatric nurses injured by assault, which came into effect on the 22nd of January 2008 by Circular 0408. The schedule of payments outlined in this document is an insult and a further slap in the face to nurses. I wrote to you, Minister, following a briefing on this scheme by the HSEA on the 25th of January as follows. As a practising nurse and national chairman of the PNA, I was shocked and dismayed to read the short document presented to us on the 25th of the 1st, which was claimed to be a compensation scheme for nurses injured by assault at work. It would appear to this observer that all assaults which had occurred over the years were analysed, the common injuries excluded, and insurance cover extended to the highly unlikely or never to happen injuries. Examples, and thankfully no nurse has been killed. No nurse has lost 2 eyes, but the loss of 1 eye is not covered. No nurse has lost 2 limbs or had them removed. No nurse has been declared quadra or paraplegic. That's 5 out of the 7 categories under major injury, for which cover is unlikely to be needed. The proposed scheme is a cop-out and smacks of a smart-aleck attitude by the Department of Health and Children and the HSE. Your own commitment of July 05 that the schedule of payments would be reflective of the PIAB Book of Quantum is now denied. Interestingly, both unions, PNA and SIP2, separately recorded your statement. The commitments given to the LRC and the Labour Court have been reneged upon. The Labour Court recommendation and clarifications have been ignored. Commitments to prevention are merely verbal and aspirational. Commitments to develop proposals aimed at reducing assaults have not been delivered on. No proposals have been put forward to address the case of the RTN3. No proposals have been put forward to address the historical cases. And nothing in these proposals will reduce the number of very costly cases going before the courts or change the adversarial settlement process for personal injuries, both of which are current government policy as noted in the establishment of the Personal Injuries Assessment Board. The PNA has now exhausted procedures. We have no procedural options remaining. Our choices are stark. The recent decision of the HSE to abolish frontline nursing posts, which have been filled by agency, overtime or other means, has further undermined the safety of staff. Our nurses are afraid to go on duty. Every day presents them with an unsafe working environment and lethargy on the part of government and employers in identifying or acknowledging hazards and putting in place preventative measures. Every professional has obligations. Arguably, their first obligation is to themselves. The day is fast approaching when nurses will be unable to go on duty due to health and safety concerns and the lack of an adequate response if they are assaulted or injured. I urge you and your advisers to revise these proposals and put in place a comprehensive response which will create a safer environment, minimise assaults, properly compensate those who are injured by assault in the workplace. Minister, I haven't heard from you. Our membership, having examined the terms of the scheme, are irate. This scheme proposes compensation to nurses of less than 20% of what similar injuries would attract under the PIAB. For example, the following comparisons. A broken nose under the PIAB Book of Quantum would be between 15 to 20,000 euro. The nurses scheme, 3,000 euro. A limb fracture under the PIAB scheme, 15,000 to 83,000 euro. Nurses scheme, 3,000 euro max. Unlike the PIAB scheme, there is no cover provided for a range of injuries, head and brain injuries, unless it results in quadriplegia or paraplegia. Nor does it include cover for neck and back injuries, spinal cord injuries, hairline fractures, any internal injuries, example heart and lungs. If a nurse was stabbed and sustained near-death injuries similar to that following the recent attack on the consultant in Limerick, she would have received 3,000 euro under the heading injury requiring sutures. Your undertaking, Minister, in July 05 that any scheme should be reflective of the PIAB scheme was reasonable. Indeed, it is my understanding that you were the driving force behind the introduction of the PIAB. Minister, let me refresh your memory on this issue. In the foreword to the PIAB Book of Quantum, it states, the establishment of PIAB is a key measure in the government's insurance reform programme, the aim of which is to tackle the high cost of insurance in Ireland. The key objective of PIAB is to significantly reduce the delivery cost of awarding compensation due to claimants without altering the level of compensation. Let me repeat that, without altering the level of compensation. On the introduction of the Book of Quantum, it states, to obtain an indication as to the likely range of compensation for a particular injury,